will start now. A very good evening to everybody. It's my honor and privilege to welcome you all to the 11th webinar of Diagnopool. And we have here with us our esteemed speaker, guest speaker, Dr. Naveen Kumar. He is our guest speaker for today. Sir is MBBS from SDUMC Kolar and has done MD Pathology from KIMS Italy. Both are prestigious institutions. And he is professor and HOD Department of Pathology at the Oxford Medical College Hospital and Research Center. He is a well-known personality in the field of medical education, and he has around 15 publications to his credit, national and international journals, and is a reviewer and editorial board member in few journals. I will stop sharing and let Sir enlighten us in this exciting webinar today.
Thank you, Zuda. I hope my screen is visible.
Yes, sir.
Yes, sir.
Okay. I'm also audible. I'm audible.
Yes, sir.
Yeah, thank you. So, let's start the session on best practices in phlebotomy. Good evening, everyone. Welcome to the session. Phlebotomy, as all of you know, is drawing of blood and is the most common invasive procedures in healthcare. So, each step in phlebotomy can affect the quality of specimen. So, that is the importance of phlebotomy, and that's why we need to have some guidelines so that we can avoid the errors. And for that, we have WHO guidelines known as best practices in phlebotomy, which was released in 2010. And these guidelines, they don't only help us improve the quality of blood specimens, but they also help us to improve the safety of phlebotomy, both for the health workers and the patients. So thereby increasing and improving the patient confidence and comfort. So in many of healthcare services, our aim will be to deliver a good patient care, and that's why these guidelines will be helpful to follow, and so that the errors will be minimized. Now coming to the issues of errors, which usually are seen commonly in phlebotomy, are hemolysis, contamination of the specimen, and inaccurate labeling. So what are the causes which can lead to hemolysis of the specimen? I hope all of you know what is hemolysis. Hemolysis is a breakdown of the RBCs. RBCs breaking down will give wrong results about the RBC indices. So that's why hemolysis should not be occurring in the samples that we collect. So what are the factors that cause hemolysis? These factors can be divided into, for our remembering the things, two of the factors related to the needle and the syringe, and two factors related to chemicals, two factors related to the force that we give to the sample. So like example, those related to the syringe and needle is gauge of the needle, or the gauge of the needle. If it is too small, say 23 or less than 23, will lead to hemolysis. And similarly, if the syringe that is used is more voluminous, it can create more vacuum. So it will have effect on the RBCs leading to lysis. Similarly, when we use more force while mixing the sample, that can lead to hemolysis. And more pressure when we force the plunger can also lead to hemolysis. The other two factors related to chemical exposures are, one is when we don't wait till the alcohol dries before introducing the needle, that can cause hemolysis. And and the filling of the sample leads to increased ratio of anticoagulants. That also again leads to hemolysis. So anticoagulant exposure and alcohol exposure can lead to hemolysis. So remember, causes of hemolysis, those related to needle and the size of the syringe, those related to exposure of the blood to the chemicals like alcohol and the anticoagulants, and increased force on the blood. Then those that are related to safety of either the patient or the phlebotomist, like transmission of the pathogens through the blood is a one risk. So the technologists or the phlebotomist should have idea about prevention of infection control. Infection control and prevention areas should be there. I will be talking more elaborately in the coming slides. And phlebotomist also should give some importance towards the patient anxiety and to alleviate his consciousness. Sometimes we can encounter the risks like seizures and loss of consciousness also. So we should know that this can happen and how to tackle it. There are few practices which are called as dangerous practices that are usually practiced in the phlebotomy unit, like recapping of the needle using two hands. So when you try to recap the needle using two hands, there is more chance of needle pricking the fingers. So that should be avoided. And what can be done is one hand scooping method. One hand scooping method means cap will be placed on the table. With only one hand, you introduce the needle which is attached to the syringe into the cap and lift up the cap and then close it. So that is called as one hand scoop method. And we should be careful while reusing the items like tourniquet or the tubes or the glucometers. Whenever the reusing items are there, we always should remember to clean them whenever necessary. At start of each session, the phlebotomist should clean them with the alcohol. And whenever the patient is disoriented or confused, always remember you should not work alone. You should always take help of an unknown person. So these are the things that should be kept in mind. And the things that can help us in protecting the patient are the training to the phlebotomist. Phlebotomist should be trained properly and adequately, mainly when it is involving with the collection of the samples from the children and infants. And health workers, that is phlebotomists, should always wear gloves, and gloves should be as recommended. You should change the gloves for each patient. And also, before starting phlebotomy, the phlebotomists need to carry out hand hygiene. That is washing of the hands, both at the start of the phlebotomy and at the end of the phlebotomy for each patient. So remember, using separate gloves and also hand hygiene, either hand wash with water and soap or using alcohol disinfect. And the work surfaces should be cleaned with the disinfectant at the start of each shift and whenever there is visibly dirty surfaces. Ensure patient comfort and privacy, and also should understand the patient rights. Patient has a right to accept phlebotomy or even to deny phlebotomy, and also verbal consent from the patient is to be taken. And a few things that you should remember regarding protection of the health workers, that is the phlebotomists protection is using a retractable lancets or needles whenever possible. And as I already told you, eliminating two-handed needle recapping. Instead, you have to recap the needles with one hand, that is, one hand scoop method. And instead of recapping around, you can directly dispose of the needle with the syringe into the disposal container. Remember that. And there should always be a availability of PEP policy, that is, post-exposure prophylaxis policy should be there in the phlebotomy room, and the phlebotomist should know what is post-exposure prophylaxis and when it is needed and whom to be contacted. The post-exposure prophylaxis will have the details of when does the exposure, what is the meaning of post-exposure prophylaxis. It means whenever there is needle prick injury or whenever there is exposure of the blood to the wounded skin. So remember, whenever there is wounded skin and the blood is exposed to that wound, that is a one indication for post-exposure prophylaxis. And one more indication is needle prick injury. So hope I am audible and are you listening, participants?
Yes, sir.
Okay. So when it comes to hepatitis B post-exposure prophylaxis, all the phlebotomists should be vaccinated with hepatitis B vaccine. If the person or the phlebotomist is not vaccinated, then what he can do is, if he thinks he has taken earlier and not sure about the dosage, then what he can do is he can check the antibody levels then. If the antibody levels are less than 10 international units per ml, then you need to take hepatitis B vaccine again. If it is more than, if the antibody levels are more than 10 international units per ml, then there is no need to take other hepatitis B vaccine. Then, when it comes to HIV exposure, say your phlebotomist got needle prick injury and he thinks that the patient may have HIV or they have risk of having HIV, then what he can do is he can start the antiretroviral therapy, and if that is done, it should be done as soon as possible or within 72 hours of exposure. Okay. Then both the phlebotomist and the patient should be tested for HIV, and if the patient results turn out to be negative, then the prophylaxis which is started, that is antiretroviral drugs, can be stopped. So remember, whenever there is exposure of the blood, phlebotomist should know whom to contact and what is the first aid. First aid will be usually whenever there is a prick, it should be washed with the flowing water, and we should not try to stop the bleeding. Hand should be placed in the running water and thoroughly washed with the soap. And then we need to contact the persons whom it is being decided in the post-exposure prophylaxis policy. So next, coming to best practice in disinfection. So disinfectant that we use to clean the surface of the skin where we introduce the needle should be, as recommended by WHO, should have 2% chlorhexidine gluconate in 70% isopropyl alcohol. And this disinfectant should be allowed to act on the skin for at least 30 seconds, and then it should be allowed to dry before the needle is introduced. Okay, so remember, the disinfectant should contain 2% chlorhexidine in 70% isopropyl alcohol, and it should be and contact the skin for at least 30 seconds. And remember, it should dry before the medium is introduced. Otherwise, as I told you, the chances of hemolysis is happening. So now coming to the steps of phlebotomy. The first one is planning ahead. The first step will be planning ahead. That is, the phlebotomist should select the appropriate place, which usually will be there. Then tourniquet, alcohol rub, alcohol stabs, cotton balls, labels, writing equipment, transportation containers, and culture resistant shock container. So always remember, shock should be discarded in culture resistant containers. So once all the equipment is ready, the next step will be identifying and preparing the patient. So what are the things that are done here in identifying and preparing the patient? First is to introduce yourself to the patient. The phlebotomist should always start with introducing himself to the patient. Then ask the patient about his details. And those details should be cross-checked with the requisition forms. And next step is to comfort the patient. Ask the patient about his allergies, phobias, previous episodes, when the blood was drawn, whether he was alright or there were any incidents, so those things should be asked. And then verbal consent should be taken before the blood is collected. So once identification is over, next step will be selecting the site of phlebotomy. So usually phlebotomy, collection of the venous sample is done from the median tubercle vein. So once the area is identified, then you should do the hand hygiene and putting of the gloves. So wash your hands, soap and water, dry it. Or if the hands are clean, you can also use the alcohol rub. So in alcohol rub, around 3 ml of alcohol is taken and should be applied in the palm, rubbing into the fingertips, back of the hands, and all over the hands until it is dry. So then put on the gloves of appropriate size. Then remember, you should not go back and touch the vein where you are pricking. So do not touch the site once the alcohol or antiseptic is applied to the site. So then apply the tourniquet. After applying the tourniquet, then you disinfect the site. So as I told you, disinfectant should contain 70% alcohol, which contains 2% hexidine gluconate. Okay, 30 seconds, always remember the contact of the disinfectant with the skin, and note that povidone iodine should not be used for the disinfection. Why povidone iodine should not be used? Because this can increase the levels of potassium, phosphorus, or uric acid in the laboratory test results. So when you apply disinfectant, remember the movement of applying should start from the center where the needle is introduced, and the movement should be towards the outside. So move towards the outer side. Then allow the area to dry and do not touch it after it is being cleaned. You touch it with your finger, again you have to repeat the disinfection of the site. Remember, the gloves that are using are not sterile gloves. Okay, so that's why you should not touch the site of the vein which is being pricked. Okay, remember that. The next step is taking blood. Here the patient, if he forms a fist, then the veins will be more easily visible. And entering of the vein, remember, the angle of the needle should be 30 degrees or less. Okay. So once introduce the needle and the blood starts flowing, then you can release the tourniquet. And after the blood is collected, because when you use vacuum containers, the vacuum itself will draw the blood, sufficient blood, and then after the blood is drawn, remember, patient should be asked to hold the gauze or the cotton in place with the extended arm. Okay, remember, the arm should be extended while patient keeps cotton or gauze on the site of needle interaction. Okay. There are more, well, because the more chances of hematoma formation is there when you ask them to hold the arm. Okay, remember that. So these are the different steps after collection, which I will be telling you here. So after collection, filling the different tubes if it is needed, and mixing the blood with the anticoagulant is very important. Inverting the tubes gently, okay. So usually around 5 to 10 times is recommended so that blood is completely mixed with the anticoagulant that is present in the tubes. The phlebotomist should always know the order of draw. So usually order of draw starts from blood culture tubes, then coagulation tubes, then the tubes for biochemistry tests. Then usually it ends with PDTA tubes, which are used for hematology investigations, and the last will be fluoride tubes. So order is important because there is chance of contamination with the anticoagulants. Okay, so the fluoride should not be contaminated, so that's why it is used at the end. Next, cleaning the contaminated surfaces and discarding the needle syringe appropriately. Again, after phlebotomy is over, hand hygiene, as I told you, hand hygiene should be done before and after phlebotomy of each patient. Recheck the labels so that the details of the patient matches. Then inform the patient that the procedure is over. And before the patient leaves, always confirm that there is no bleeding from the site. Okay, so check the site, ensure that there is no bleeding. Then the patient then be sent out. And if the lab is bit away, then you have to know the transportation. While transporting, always remember the plastic leak-proof bag should be used, and the request forms should not be very close to the blood samples, and the bag should be such a way that there is no scope for breakage. Say if there is a spillage of blood, you should know how to manage the spill. So usually there will be a spill kit. So say if there is a spillage, you have to put on the gloves and the apron if needed. It is a large spill. Then usually spill kits will have absorbent material like paper and cloth. First you need to put the absorbent material onto the blood. This spill on the table or on the surface. Then you have to pour sodium hypochlorite 1% solution. Allow it to act for around 10 to 20 minutes. Then it is cleaned. And this can also be documented. Okay, so that it can be informed to the nursing staff also. Always remember, sodium hypochlorite solution should be prepared fresh whenever it is used. So what is the gauge of the needle that we usually phlebotomy should always be known to us. It is around 21 and 22 gauge needles are used in adults, and for the pediatric and neonatal patients, it's around 23 gauge needles. So these are the different blood sampling systems, like the instrument that we use to draw the blood. So one is needle and syringe and the phenoid, and usually now most of us use vacuum systems, that is the tubes which have a vacuum. So as soon as we introduce the needle into the vein, that vacuum draws the blood. And one more instrument is winged butterfly system. This winged butterfly system can be attached both to the vacuum tubes and also to the syringes. So these vacutiners will give us a safety that there is minimal risk of exposure of the blood to the skin. So if the patient is pediatric patient, neonatal or a child, so what is important is the immobilization of the child. Very important to immobilize the child when drawing blood. So what are the ways we can immobilize child? So usually one helper will be needed. So parent will be helping us most of the time. So technician or the technologist will stand on one side of the table and the helper will be on the other side of the table. You can see the photo here. So parents, one of the hand of the parent will be on the back of the head of the child, and child will be laid on the table. And this hand will be coming in the elbow of the child. The other hand will be reaching up to the wrist of the child. So what happens here? One of the shoulder of the child is locked, so that child will not be able to move much. And also there is stability to the hand which is being used for the drawing. And the parent can also squeeze the wrist, okay, which can help in the flowing of the blood. If the child is held up, parent can sit on the chair, and the child will be sitting on the lap of the parent. Parent will cross the legs over the legs of the child, so that child's legs is locked, and one of the hand of the parent will be at the wrist and one more hand will be at the elbow, so that here you can see the child's shoulder is locked, and also child's legs are also locked, so that the child will not be able to watch. So that immobilization is very important when drawing of blood from a neonate or a child. So these are the same steps that I have already told you. One more important thing is the child should be warm. Child should be kept warm. Okay. Only then the veins will be prominent and dilated. If the child is exposed, that is dressing is not very appropriate, if the hands and chest are exposed due to cold, the veins will be contracted, so that it is not easy to draw the blood. And these are the same steps that I have told you before. Applying disinfectant and drawing the blood. Then when it comes to capillary sampling, which is not very commonly used, the site for capillary sampling can be most commonly used is finger. And remember, usually middle finger or the ring finger are better than the other finger. And the other sites for capillary sampling are heel and ear rings. And what we need to remember here is heel prick is preferred only when the patient is less than 6 months and the weight of the child is less than 10 kg. Otherwise, finger prick is better choice. Length of the lancet, you can remember that in adults it will be around 2.2 millimeters and for the child it should be around 1.5 millimeters and not more than that. So procedure is almost same. So first need to be alcohol need to be applied and what need to be remembered in case of finger prick or the heel prick is that the first drop should be wiped away. First drop of blood should be wiped away because it is contaminated with the tissue fluids. And then one more thing to remember is that finger or heel should not be squeezed for the blood. If you squeeze it, what happens again, the tissue fluid will contaminate the blood. So, training of the phlebotomist is very important for the improvement in all the fields of phlebotomy, all the aspects. If you need to be improving day by day, then what we need to do is training of the phlebotomist by the lab doctors. And what are the topics under which training can be done is starts from the basics, that is anatomy of phlebotomy sites. Okay, what are the sites? What are the veins? Okay, which veins should be avoided? So this anatomy should be known. What are the structures very close to the veins which we should not injure them? And hand hygiene, wearing sterile gloves and non-sterile gloves, use of antiseptics to the skin, cleaning and disinfection materials which are used more than one time, like tourniquet, scissors, carriers, and also glucometers should be cleaned so that there should not be transmission of the diseases, because usually epidemics of hepatitis B and methicillin-resistant staphylococcus has been related to the tourniquet and glucometers which are not being cleaned. So always remember the materials which are used for more than one patient needs to be cleaned regularly. And training can also include under biomedical waste disposal and the topics related to protection of the patient. Okay. Protection of the patient, like patient identification, and informed consent from the patients, and managing the supplies. Okay, so all the materials should be adequately present. Okay, at least indent should be done 15 days to 30 days before the indent expires. Okay, the material that we have expires. And also always remember at the site of needle entry there should not be scars or infected wounds. Okay, always avoid those areas. And other topics which are related to protection of the health workers are like immunization, okay, which needs to be known. Awareness of high-risk devices and practices. The high-risk practices, as I already told you, use of 2 hands to close the needle with the cap, so that should be avoided. And always the training should include regarding post-exposure prophylaxis. Okay, the phlebotomist should know whom to contact, when to contact. Okay, when is it called as exposure. So all this things should be trained in a training process. So this already told you 200 ml caffeine should be avoided. Appropriate use of personal protection is always be practiced. So these are the different topics that can be included in the training of the phlebotomists. When explaining the procedure to the patient, this will take some time. Phlebotomists will always take some time to talk to the patients. Okay, so this is an example how you can go about it. First, you should introduce yourself to the patient and you say what is your name and say what is your experience. You can say you have been working here for so many years. Then the patient will get confidence in you. And you should tell him that you will be drawing the blood, introducing the needle, and ask him if he has understood it. If he has not understood, you can tell him in his own language. And then you should ask him about the previous encounters, whether there was any incident, whether he was comfortable the previous time when the blood was collected from him, or were there any incidents like fainting or anxiety, allergic episodes. So those things should be asked from him so that proper care can be taken. So then after comforting the patient, then start the procedure. So that's about phlebotomy. The take-home message for our technologists. So our technologists remember the practice collection of a quality sample. What I mean by quality sample, you understood the quality sample, meaning that it should not have hemolysis. Just a minute. The good quality sample means sample which is devoid of hemolysis, no contamination, with correct labeling. So these are the basic things that need to be followed and to inculcate safe practices. Safe practice means avoiding the injury either to the patient or to the cell and avoiding disease transmission. So that is very important because we need to practice disinfection. Disinfection both to the surfaces and to the hands before and after the phlebotomy. The next is quality assurance, which includes training of the technicians. And technologists should also know that there will be SOPs for each and every procedure. SOP means standard operative procedures. It means each procedure, say phlebotomy or even running a sample with any instrument, will have many steps. Okay, when you write down each step from the beginning to the end, okay, so that is a SOP, standard operative procedures. So you should ask your doctors, laboratory doctors, to provide the SOPs for all the procedures that we do, including phlebotomy, and technology should always keep reading the material, like training materials, SOPs, and also practice documenting. Okay, whether it is an adverse event like spillage or if there is exposure like knee injuries or exposure of the blood to the wounded sites, all these things should be documented. failure of phlebotomy, all those things can be documented. Okay. So what you can start doing is start with the simple things like I don't think most of the phlebotomists will be cleaning commonly used items like tourniquet. So most of us see the tourniquet lying around in the phlebotomy rooms. So you can start with cleaning them regularly. Avoid touching the site of the needle introduction after you clean the area with the alcohol. And always follow the waste disposal according to the color coding and practice talking to the patient before the phlebotomy and during the phlebotomy so that patient comfort is important and that can also help you to improve the quality. And the take-home message for the doctors is that training and evaluation is important and training and evaluation can include the procedures that are done in the laboratories regarding the biomedical waste disposals, infection control practices, team management. These are the things that can be included in training sessions. And also remember the training will not be same for all the technicians. Technologists who are new, the topics for training will be different for them, and the experienced technologists will be needing different topics. So that should be kept in mind. So always prepare the SOPs. Example like SOP for a phlebotomy procedure or skill management and should be available to the technologists to read and follow them. Post-exposure prophylaxis policies should be there in the phlebotomy rooms so that all the technologists should be aware of the steps that should be followed whenever there is exposure and when to contact. The details should be there in the post-exposure prophylaxis policy. And it is always good to have a leaflet or a poster explaining the procedures. Okay, so patient can go through them whenever they are waiting in the phlebotomy hall. So that's about best practice in phlebotomy from my side. Any doubts?
Sir, just one doubt, sir, by Dr. Shankari Sharma. How many samples can phlebotomist collect during a shift? Any criteria laid down by ISO?
Number of samples collected in a shift.
By a phlebotomist, how many samples he can draw in one shift?
So there is no there is no recommendation for that. So what I need to tell is should not be hurrying too much. So you need to comfort the patient, which is important. You need to practice all the disinfection of the hands and to the area that you are working with. Okay. So as such, there is no norms for that, but you need to follow the steps and not to hurry up is what I tell you. Anything, Zubair or
Any other question?
Divya Lakshmi can add to it.
Sir, about filling of the consent forms, for most of the HIV patients, in small labs, they are not taking consent form, they are not filling it. Actually, right now it is mandatory to fill the consent form when we are collecting for HIV samples.
HIV, you're talking about HIV?
Consent form for before doing HIV tests.
Okay.
Serology.
Okay, so HIV actually has different indications for the consent. Say if the patient is undergoing the operation, then consent for the operation itself is a consent for all the tests that are needed for the patient. Okay, so all the patient doesn't need consent for HIV unless we are asking only for HIV testing without any other indications, then we need to have consent.
Okay.
And one more thing, One more thing I would like to tell here is that usually we see case sheets where it is boldly written that hepatitis B positive, HIV positive on the case sheets. That is not a correct practice and that should be avoided.
So it was a very nice webinar you covered. So you covered all the aspects which we routinely tell our phlebotomists. You have covered spill management, you have covered needle stick injuries, and procedure of blood collection. I think you have covered everything, every aspect of it. And usually that forms a part of the training calendar for our phlebotomists here also. Your webinar was a very good overview. This is what 1 hour you can do justice. Very good. Any other questions are there? In my experience, we have had a lot of enable agencies in the enable audit, phlebotomy area, and the pre-analytical area, and we continue to keep having it because one or the other thing keeps happening. Even when we are best prepared, phlebotomists tend to fumble sometimes. One time the phlebotomy failed in front of the auditor. So those things happen. Sometimes, they could not correctly recall the time for this thing, the contact period for the spill. Sir has mentioned is 10 to 15 minutes. That also they will fumble. And the repeated trainings are required. That is what we have to do.
So phlebotomy, I also learned that it is not simple. There are so many things to learn in phlebotomy also. So it was a good chance for me. Thank you, Dr. Zubair and Eva Lakshmi.
Thank you, sir.
Thank you, sir.
Please fill the feedback form. And a little bit about Diagnopool here. It's been some time why we started the journey. We started the journey so that we can outreach to the smaller labs which are not having a regular training program and may not be having doctors full time as well. That is the idea of having this Diagnopool. Apart from that, we had other objectives as well which have not really clicked off. We thought we will supply pathologists or form a reporting service. All that we could not do, but right now we are giving the trainings. That is the idea of having this program time. But you can reach out to any one of us if you have any assistance needed.
Okay. I would like to listen from technologists.
Yeah, please. You can share your
Diagnopool.
Two-way communication always better. Please share your
Venkat, are you there?
Good evening, sir.
Good evening, Venkat.
ಚೆನ್ನಾಗಿದ್ದಾರೆ
ಅರ್ಥ ಆಯ್ತಾ ನಾನು
ಅರ್ಥ ಆಯ್ತು ಸರ್, ಕ್ಲಾಸ್ ಚೆನ್ನಾಗಿದ್ದೀನಿ.
ಏನು ಪಭಾಟಮಿಯಲ್ಲಿ ಏನು ಕಲಿತೆ ಇವತ್ತು? ನೀನೇನು ಮಿಸ್ ಮಾಡ್ತಿದ್ದೆ ಯೂಶಲಿ ಪಭಾಟಮಿಯಲ್ಲಿ?
QC ಬೇಕಂದ್ರೆ ಏನಿದೆ ಸರ್, QC ಬಗ್ಗೆ ಮತ್ತೆ ಕನ್ಸೆಂಟ್ ಫಾರ್ಮ್ ಅದೆಲ್ಲ ಏನಿದೆ ಅದೆಲ್ಲ ಅರ್ಥ ಇದ್ದೀನಿ ಸರ್.
ಓಕೆ. ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
Thank you, sir. Thank you for such a detailed discussion. Though the topic was simple, it is a very useful topic, and where all the lab professionals should be aware of the best practices in the phlebotomy. Apart from lab technologists, I see many doctors who have attended this show today. I thank each and every doctor, Dr. Raja Pathiban sir, Dr. Shankari madam. I thank each and everyone for attending today's program. I request all of you to fill the feedback form.